morning, everyone, and welcome to Great Day Houston. As we age, we can actually see certain parts of our body evolve. For example, our mouth, probably the most visible. When we're born, we can't see our teeth, and then our teeth come in, then they fall out, then they come back in again, and as we get older, they could fall out again. At Evolution Dentistry, they meet us where our mouth is to help our mouth become the healthiest it can be, pretty, and functional. Let's go inside and get to the root of all the services they do. Dr. Kheir, smile big to the camera because you are not just a doctor, you're also a patient. I see you have braces in there.
Yeah, look at that. Huh?
There are basically three areas that bring us in as patients. One is aesthetics, we want to fix something. The other is we're in pain. And the other is we may not be able to use our teeth because we have missing teeth. So let me address each one of those issues. I'm going to start with those braces in your mouth. Some people want braces, the wire, right? But other people like to do it invisibly with the invisible liners. You do that as well.
I like metal braces because they tend to move teeth faster. But the other options were quite a bit of section of the population, they don't want to see metal in their mouth, so we go with the clear liners actually.
But for those people who are impatient, you also do veneers, which that can happen even quicker.
Patient who doesn't want to wear anything like liners or metal, which basically may last between 6 months to 2 years, wanted something within weeks where you could change the shape, the color of your choice.
Yeah, and when you say color of your choice, that's something else you handle that's pretty easy. You can whiten teeth, and sometimes when the teeth look brighter, it hides some other things that we might have going on. One thing you can't hide is missing teeth. A lot of people do that. They don't smile. They don't eat foods that they need to have as part of their nutrition because they just can't. And that's a tough situation. A lot of people have been told that there's nothing they can do about it because they've lost too much bone. You want people to come in. You all are experts at the toughest cases because oftentimes an implant can fix that.
A lot of patients, again, due to not meeting the proper professional that handles a complete comprehensive work, that we look at the entire system and we will actually offer them the best tailored treatment for them.
Yeah, what's it like to see someone who had given up all hope and all of a sudden you hand them the mirror and all of a sudden there's a full mouth of teeth again?
Oh, you don't know. I enjoy that. That's like, hey, I'm a winner. I could do it. And the patients feel really gratified with that.
Yeah, all right. And the other thing, of course, is just keeping up with your general dentistry. It's one of those things that so many of us, we don't do it until we're in pain. You just want to make sure that you establish a relationship with you all so that you can follow the evolution of our teeth. And sometimes you can avoid some of those big problems from happening.
Prevention is the best medicine, the statement goes. And it's the same thing goes for dentistry. The more we see you from early time, we can monitor and basically prevent other issues from happening.
Yeah. Why did you decide to go into dentistry?
I love art. One time I was drawing and sculpturing, and then I realized dentistry has some of it, helping people and making them beautiful. I love aesthetics. I love to make beautiful teeth and beautiful smiles.
Yeah, when you say art, no piece of original art is exactly like another. Every patient is different. When you're fixing teeth, you're looking at how does it fit with their smile, with how they talk, with their facial features. So it's all custom tailored to each patient.
Patient have some idea they want to look like, old pictures, a movie star, whoever, they bring them in, and I literally mimic that exactly. I deliver that to the lab, make sure that they address the patient's needs and put them in patient's mouths. And we had such a success with that.
Yeah. You also talked about the experience that you have. You cover things that maybe some other dentists might not be connecting those dots, or it's just something that they don't do. And that is TMJ, migraines. There are a lot of people who will medicate a migraine, but not get to the root of what's causing it. And oftentimes it has a connection to what's going on inside your mouth.
TMJ, which is the bone on both sides underneath your ears, that's a joint that moves and translates. And what directs that positions of that joints are your teeth. If they're misaligned, you could assume that the joints is going to be out of line.
And sometimes it's misaligned because there's something structurally going on, but oftentimes if you've had patchwork over the years,
absolutely,
things start to get a little cattywampus, right?
If they're misaligned, they're short teeth, not in the right spot, they disposition the joint, and that causes headache, migraine, earache. So I look at the entire system and trying to reposition the joint first and look at the teeth. If they're not synchronized, then the teeth has to do something to bring that up to the point.
We're going to talk to one of your patients who had migraines after migraine, and they couldn't figure out what the problem was until she came to you, and let's see what a world of difference it made for her.
I was having migraines for over 20 years, and when I went to go see Dr. Kheir, I brought it up in our exam that I had really bad migraines, and I was taking Advil. I mean, I had a bottle right next to my bed, and I'd be taking it about 4 pills every morning, have to take some more in the afternoon. And once I mentioned that to Dr. Kheir, we did a comprehensive exam, and he was able to tell me that it was a TMJ issue. And so he used therapeutic Botox and adjusted my bite. And that's been over 6 months ago, and since then I haven't had one migraine at all. So it's made a big difference.
So, Dr. Kheir, obviously what really counts is to have not just experience in one area, but experience in several areas, because what's convenient with you all is whatever is going on inside your mouth, it's all going to be taken care of under one roof.
My partner, prosthodontist, with 30-some years experience, I have 29 years that I've been doing almost complete smile makeover. We've had such a success with that.
Thank you, Dr. Kheir. And by the way, I love how your last name is pronounced Kheir, because you really care about what you do.
Yes, I do. I have such a passion to it, and the most of it is giving patients what they want. That is basically absolutely make me very happy. By the way, Deborah, I mean, when was the last time you had somebody check your teeth?
Oh,
well, you're here now.
Yeah. Well, it's probably about time for a cleaning.
Well, this is the time.
Okay.
We're ready for you. Here we come. Deborah, could you please open up?
Uh-huh.
Wonderful. That is awesome. Thank you so much. That looks good.
And Dennis somehow can understand whatever you're saying. Mention Great Day Houston when you make an appointment at Evolution Dentistry, and you'll receive a free consultation. That is a $250 value. Also, get $500 off implants. For more information on Evolution Dentistry or to book an appointment, visit their website, evolutiondentistryhouston.com, or you can call this number. It's 713-647-8000. Again, that's 713-647-8000.